A world without vision, without sound, without being understood.
I don't understand.
Without being able to do the things that most people can. It's not just about walking and talking fine. After all, not every disability is visible. For at least 2.33% of Malaysia's population today, that might just be exactly what everyday life is like. I know what you're thinking, that's such a small number. But imagine 798,215 people appearing in front of you right now. Not so small anymore, right? Well, we're not the experts here, but he definitely is.
It's like your typical patient. They need at least 3 monthly to 6 monthly regular follow-ups. So patients with disabilities also need, some of them may need up to monthly follow-up depending on their risk factors, on their dental disease, caries risk factors. So those with higher risk factors have to be seen regularly. Of parental influence. If the parents have higher oral health awareness, oral health literacy rates, then they would have started follow-up earlier on in life. Patients with disabilities, they rely on other people to bring them in. Usually we face a lot of patients not turning up for appointment just because they're relying on other people and the person who bring them in can't make the appointment or have other things. Usually a facility that's accessible by wheelchair will do the best. So wheelchair accessible facilities, you need to have ramps, special needs parking, and a wide doorway and waiting area, and also disability accessible toilets in your practice. And also when they come into the dental chair, with specialized equipments like wheelchair tilters to tilt the wheelchair to provide dental treatment, or you can even have hoists to lift them out of their wheelchair and transfer them, or even some of them have transfer boards to use to transfer from the wheelchair to the dental chair. So you can use transfer boards to transfer them onto the dental chair. And then providing treatment equipment, the handpieces are all the same, but we do use specialized local anesthetic delivery device that's known as a computer controlled local anesthetic delivery device that actually delivers local anesthetic painlessly. So basically they don't feel the pain, but they feel numbness after that. There is a needle involved, but it's very tiny. So it's a very good technology that actually helps painless local anesthetic, pillows, cushions to make the patient feel more comfortable, and also aids like TV screens to distract patients on their favorite cartoons, ceiling mounted or the chair mounted TV screens for them to watch movies, and also you can use of headphones to listen to music, or music, background music, aromatherapy, all that actually helps a lot in putting patients at ease. As I said, we are reliant on the patient's family or carers to help us, because as you know, oral health prevention, you need to brush your teeth every day and keep it clean. We only have a fixed amount of, let's say, half an hour with the patient in the clinic, and the majority of them we rely on carers to maintain oral hygiene. In terms of diet, daily oral hygiene practices all actually impact on oral health. The challenge is to get them brushing their teeth every day, getting the parents or carers to help them brush and keeping their mouth clean. Cooperation or getting the effort to go the extra mile after the dental appointment really matters. What I have seen so far in my years of practice, patients with disabilities come with a multitude of health issues, and among the health issues medical issues are more vital, and usually oral health is least of the priorities. It's way down there. The family members, carers are mostly overwhelmed as it is, and then for us to add on oral health is another problem. So usually we try our best to help family members, help them in achieving optimal oral health. Can't judge. We have to be non-judgmental, put ourselves in their shoes to see the world. I hope in the future patients with special needs will be able to access routine dental care anywhere, everywhere and anywhere, and there will be a specialized dentist who cares for these patients in possibly at least every district or every state, at least about 4 or 5 of us, and at present there's not more than 20 in the entire country, so the more the number and the better it's going to be.
The statistics speak for themselves. Patients with disabilities indeed are in most need of accessible dental care. The main question? Probably, where can I go? Here are 6 government facilities providing special care dentistry across Malaysia. The services range from basic checkups to fillings and extractions. For a smooth process, be ready with the necessary identification and documentation. And what about the cost? Malaysia's healthcare is heavily subsidized and even more so for special care patients who fall under Class 3 in this chart. Patients can also seek treatment from registered special needs dental specialists at these 4 public university dental faculties. Less abilities do not make less of a person. Let's all help to break the stigma and make dental treatment accessible to those who need it the most.